Welcome back to the latest episode of Taking Charge of My Cancer podcast, episode 92. And it is a pleasure to have as my guest Dr. Sandra Pyda. Did I say it right? Okay,
Pyda.
so she is currently located in Gainesville, Florida. Her primary work at HCA North Florida as a hospitalist physician, and she's also part of the GME Family Medicine residency program with her function as a core faculty assistant professor precepting in the clinic working with the residents, and she's involved with the residency program. She went from being the physician to the patient when she self-detected a lump in her breast at age of 30 years old and diagnosed with breast cancer at age 31, I'm sorry. It all happened on a pivotal moment in her life when she was preparing to finish her residency training, take boards, and start her next chapter on her life, transitioning to an attending. It was incredible, tough, and challenging year, and the fight continues, but she learned a lot, continued to learn, and has become a better person as well, a better physician because of it. So it's totally my honor to have you on the podcast, and I'm so looking forward for this today, Sandra. Thank you
I'm
so much.
thrilled for having me. Thank you. It's an honor.
Awesome. So tell us a little bit about your role, or were you always planning to become a physician?
Mhm. I can remember as young as 5 years old, I found an old bibliography and it said, "What do you want to be when you grow up?" I always wrote, "I want to be a doctor when I grow up." So as long as I can remember, I wanted to be a physician, help people heal, all the things that come along with it. But family medicine, that is, I wasn't sure what kind of doctor I wanted to be. Happy I ended up in family medicine. And then during residency, there's a lot of different paths that you can take. You can work in clinic or as a hospital medicine doctor or do fellowship further your training. But about halfway through, I really enjoyed my hospital medicine rotation. I liked the acuity of the and the pathology in the hospital. It was very challenging. So then I decided to come on as a full-time hospitalist. And then I never I never planned on becoming a faculty or working in academics, but this was an amazing opportunity that I was presented with and that I happily accepted. And it's been one of the best blessings. So I love teaching the residents, giving back. I mean, they teach me probably more than I teach them. So I'm very happy with where I'm at right now in my career.
That's awesome. That's so great. And then I have the pleasure to meet you for the very first time. I believe you came as your pre-op appointment after Dr. Spiegel saw you. And then you want to tell us a little bit about, well, let me go back. So I have the pleasure to meet you, and I was like, oh my God, she will do awesome in this journey. She is strong, she has the knowledge, and she will. I know it's hard, and you were in a situation which is not easy to be where you were at in the middle of finished residency and all that. I mean, it is not easy to find a cancer diagnosis, period, no matter what part of your life you are. But at this moment, it's like, man, you're young, you're like right finishing your resident, and then you get this news, which, is shocking. And you were still in shock when I met you because that was about maybe 2, 3 weeks after you're diagnosed. So a lot of things are like really convolvulating on your brain, right? Like, oh my God, like what was just happening? But but you've been amazing since then. So again, I think maybe you were working with one of my colleagues, Shannon, and I'm like, oh my God, Shannon, I would love to have Sandra on the podcast because I think she'll bring a lot of great learning for my audience. So here we are. So tell me a little bit
I was
about.
honored to be here, and I want to thank you because I will never forget that first moment I met you. You were right. It was the beginning, right after my cancer diagnosis. I didn't even have a surgery date. This was the pre-op appointment, and typically you have so much more information. And I just remember, I'm not sure what your impression of me was the first when you met me the first time, but I was frustrated. And I know we'll talk a little bit about advocating for yourself and all these things, but you really listened to me when I was, you asked questions, you listened to me, and you even took the initiative to help me. You reached out to people to be like, this girl needs a surgical date. She needs more information. She needs people to get back to her. So thank you so much for advocating for me and being, part of kind of getting that process going, because I just felt so lost. It was.
Absolutely. Absolutely. My pleasure. And again, I have the fortune to work with a great multidisciplinary team that this is all what we do. If it's something is lacking or a patient needs to get into PT, then yes, I get these epic messages or text messages from the physicians like, would you be able to get this patient in? And absolutely, we work really well together because we are all about the patient, right? It's what is best for the patient. So, but tell us how this whole thing happened. How did you find about your diagnosis?
Oh gosh. So it's funny because now, since I'm past the active treatment, which a lot of times you'll hear the active treatment of cancer or breast cancer, I've been just so busy and working, and I haven't really thought about things until you've asked me to be on this podcast, and I really had to reflect. And a lot of emotions came up, just how I got to this point. I remember I was working on nights. It was the middle of the night. I was just scratching my chest, and I feel a lump, and it did not feel like any typical lump. I mean, I'm a physician. I felt breast cancer lumps. I palpate masses that are malignant. But this felt almost like a bone. I thought, did I hit myself? And it was in a weird spot where I thought this isn't even breast tissue. So of course, none of these thoughts even went through my head, but it was abnormal. So I said to myself, don't be a hypochondriac, just monitor it. If it is anything associated with the breast, see how you do after one menstrual cycle. If it's still there, make an appointment. Made an appointment with my OBGYN. Even the OBGYN did a physical exam. And I have fibrous breasts, which is also a term I feel like all women should know, regarding themselves, because it can be a risk factor. But she said, the other breast, I think I want to do an ultrasound one, but this area of palpable concern, it does not feel like a mass. But she said, why don't we just send you for a mammogram and ultrasound? I was like, oh my gosh, 30 years old and I'm getting a mammogram. But went for the mammogram, showed a hypoechoic mass, dimension was like 1 centimeter. So of course you go for the biopsy. And the biopsy this was all through UF. It was very difficult to get. This is another thing that opened my eyes, just being the patient. It wasn't as benign as people think. It is painful. It can be a little traumatic. It was hard to get the biopsy, but I get a call from the OBGYN a few days later. Good news, this isn't cancer. And then the next day, the radiologist that did the biopsy, Dr. Hannah, which I love her, she's another amazing human being that advocated for me. She said, listen, I know the biopsy came back as single dystrophic calcification, which is benign, but I don't believe it. And I think you should get a second opinion to get
Wow.
an biopsy. And this is funny, when in medicine, nothing is black and white. Everything is open for interpretation. You can't just go based off one little thing. She went with her gut, knowing that was a very difficult procedure. It was difficult to get that biopsy. That's not a normal mass. So I went for a second opinion with a surgical oncologist. They also, looked at all my risk factors. I'm young, so that was on my side at that time. I'm healthy. I've never even broken a bone. I've never had any medical problems. Only thing I've been using was an OCP for the last, I don't know, 13 years. Only medication I've been on. And she said, well, why don't we do genetic testing? If it is normal, if it's normal, then we're not too worried. If it's abnormal, of course, we'll go for the biopsy. I'm like, well, what do you think? Should we do a surgery right now? Should we not? She says, let's base it off the genetic testing. Genetic testing came back normal, nothing in the genes. So we can either just, watch it closely. I think that's pretty fair to watch it closely and take it from there. So I had an ultrasound 3 months later, stable mass, same size, and then an MRI 6 months from my first mammogram MRI. And all of a sudden it showed, I read it, the impression, and it said it doubled. And I'm like, that's it. I know this is cancer. No way does this grow overnight like this. And then the next day I got a call from my OBGYN, I think, that I should go get for the biopsy. And then I'm on my way home, and I'm actually interviewing at this point for hospitalist physicians. I'm graduating residency, and I'm just came out of an interview in South Florida. I'm driving home 5 minutes, heading onto the turnpike, 5 hours left in my drive to Gainesville, and I get a call from the front desk. Yeah, so the pathology came back that this is cancer. It's DCIS and IDC, invasive ductal carcinoma, and carcinoma in situ, ductal carcinoma in situ. And my mouth kind of dropped. I'm like, you're kidding me. She's like, no, no, it's cancer. So people are on vacation now. So we'll see you in 3 weeks to talk about it.
Oh
Hold
my
your questions.
God.
And ever since then, the craziness started. It was absolutely chaotic. And in that time, I've had to go through surgery, and initially didn't need chemo. But my oncotype score came back high, so I had to do chemo and radiation, and started endocrine therapy, and I'm continuing that. So all the modalities, and here we are today.
Okay. Well, thank you for sharing that. And again, it is, and this is a very well educated woman who is a physician, and you go by, okay, here we go. And even though, the radiologist is like, I don't have a good feeling for this,
Mhm.
but we were doing the right thing, right? Let's monitor, let's monitor. I wonder if at one point you're thinking, if we didn't monitor and we just went ahead and took it out, did I end up having everything that I end up having? I mean, your oncotype wasn't going to change,
Exactly.
but I
Absolutely.
don't know if do you think that any of the treatments will be changing?
That definitely ran through my head, because that lump that I palpated May 2022 was cancer. It doesn't There's not a lump and then it randomly turns into cancer. I guess the biopsy just missed that area of it. So if we would have excised the whole mass, it would have shown that. So between then and when I was actually diagnosed February 17th, the mass had doubled, by, like, I don't know, 1.3 centimeters it grew. So it did change my staging, I think. But who knows? I definitely battled with that thought a lot, and I try not to think about it because you can't go back in time. But you know it it did change the staging, and maybe my treatment plan wouldn't have been so aggressive, but who knows.
Yeah, yeah, it is over. And again, we're learning from this experience, right? And then we always kind of, and again, I know Dr. Spiegel is great about those things. It's like, how often do we monitor that? No, she tends to be more like, let's get it out versus not. Like, if it's something
Mhm.
benign and something is there, should we just really move it or not? It's always that question, because we, as only human beings, right? We cannot really see through everything. And you're right, the biopsy is only taking a piece of a tissue that can miss the next tissue. So it's really, even though has to be diagnosed with a biopsy, but sometimes even biopsies can be an error if it's not the right tissue.
Yeah, and
So
that's the important thing with following up and making sure you get your questions answered. And it was a lot, because if I would have just stopped right there and not gone for the follow up and people told me don't worry about it, who knows where I would have been in
yeah,
my life right now.
exactly. So based on this learning, if you can share three valuable tips with patients that perhaps are going through similar situation, what that will be?
Mhm. I think that there's a lot of valuable tips, lessons I've learned, but one of the most important thing is educating yourself and making sure you get all the information possible that can be available to you at that time to make the best educated decision that you possibly can. Um, taking the time to understand what the physician is telling you. If you don't understand, asking them to explain it to you. Looking at through reliable resources, to help you make those difficult decisions, because this journey, if I could summarize it in one word, the perfect word would be overwhelming. Just completely overwhelming with all the information and the treatments and the decision making fatigue that I had throughout this journey. So educating yourself and really going off trusted sources, and even getting second opinions, second, third, fourth opinions. That's the biggest thing. uh, I would say another very important thing, if not one of the most important things, and is building your really good support network. These are the people that will help you when you're in your deepest, darkest moments. When you feel like you can't go on, they will be your cheerleaders. Um, they will be the ones that you're going to be leaning on when you feel like you have nowhere else to go, that you've hit rock bottom. This disease can be very isolating. That's how I felt a lot, especially at 30 years old. So maybe even uh, joining, groups, finding resources that with women that are going through something similar, although it's so rare because the median age of breast cancer, was 60s. I'm
Mhm.
curious to see what it's going to be like in the next few years because more and more women are being diagnosed younger. But so trying to find people that are going through something similar as you is important. And then this is one that I will start off by saying I will be hypocritical because I didn't do this enough. And looking back on it, I wish I have. And it's prioritizing yourself. I feel
Mhm. I
like
know you didn't.
I know, I know it's the worst thing, but it, I don't know. In the beginning, I just felt like this wasn't even happening to me. I just wanted to get everything over with and move on with my life. And it's not. It's not like that. It's not that easy. But prioritizing your self-care, to really checking in when you're tired, take a nap when you don't want it. If there's ever a time in your life to say no to something and do something that benefits you, it's now. And you don't have to explain yourself like now during a cancer diagnosis. You don't have to explain yourself to anyone else. So whatever that means to you, prioritizing yourself and self-care, I feel like that is one of the most important things that you should do. I didn't do, and but I've learned from it moving forward.
Absolutely. What how about how is that impact your mental health? And what type of resources have you been using to help with this part?
um by being diagnosed with breast cancer, how has that?
Yeah.
So of course, receiving such a shocking, um shocking diagnosis, and it's not, I wouldn't say in the moment it's life threatening, but you do you don't know what your outcome will be when you hear that. You don't know, oh, am I stage 1, am I stage 4? Will I need to do chemo, radiation? All these thoughts went through my head the moment that I was diagnosed. I was just in complete shock, disbelief, and I feel like I almost disassociated with myself. I didn't believe that this was happening to me. Sandra, who is about to enter the prime of her life, this healthy, person that lives life in moderation. And I thought I didn't have risk factors. I mean, but we all do. Um, so that initial shock is hard to get over, but the mental health part of this journey is what I didn't realize until at the end was how the treatments would impact my mental health, not just the diagnosis, but honestly this endocrine therapy that hormone positive breast cancer patients have to, well, don't have to, but are advised to use to reduce their risk of recurrence, to treat their cancer. But the amount of side effects that you experience really does impact your mental health and your quality of life. Um, so that was a big thing that I've learned. Resources, really, to me, I spoke to everyone about this as much as possible. I tried to get everyone's that mattered, at least, intake on or input on how they would handle this. What do they recommend? I leaned on colleagues. I'm very lucky to have colleagues that cared so much about me, that would look through guidelines and resources to help me make decisions about my chemotherapy regimen, my radiation. And there's so many decisions you have to make. And uh, that was the main thing, and just doing my own research, um, whether that's listening to other cancer survivors or someone going through active treatment, how they're coping with it. And that would help me cope with my mental health, because seeing someone else feeling the same way and not being perfect and not hiding their negative emotions, just made me feel less alone and more normal, to
That,
say, in such an abnormal situation.
mhm. So you mentioned something about endocrine therapy, and that's a very hot topic right now. And I'm
Mhm.
gonna jump the gun here. What are your thoughts? And I know it's hard because you're not only a physician, but as well, you are a patient who is hormone positive.
Mhm.
But it is a lot of controversy now in, do we really are doing a good thing to do hormone blockers? and creating all these issues, is that really something that for sure, like, I've been hearing some functional medicine podcasts lately, and it is really talking about a lot of like, how your whole body, everywhere in your body, you have estrogen everywhere, right? And so, how do we really know, yeah, this estrogen was what produced my breast cancer? And then, on the other hand, is like, do I risk all these other effects for somebody who is young, and then inhibition or like diminished estrogen is so important, not just for the body but the mind, and a lot of different things that go on with that, versus don't, like, what, like, have you been
That
come
is
across that, or
Yes, yes. That is such a, I think you having this platform, it's so important to bring this issue into light. And honestly, I never even realized how important it was until I was going through this. But um, so I'll start by saying I was estrogen positive, progesterone negative, HER2 negative. So I was a candidate for endocrine therapy to block the estrogen because my cancer was, estrogen positive. Um, Looking back on everything, surgery, it's tough. Every step in this journey was tough in its own way. Surgery is difficult because you're going through physically altering changes. The pain, the recovery, seeing yourself look completely different. Then the chemotherapy, we all know the hair loss, the fatigue, the weight gain. I luckily used cold caps, so I didn't lose 100% of my hair, but I lost about 60% of the head of my scalp. It was extremely painful and difficult to endure during my treatments, but it did save some hair. Otherwise I'd be bald. I lost hair everywhere else. Then the radiation, every day going for driving back and forth to radiation, you get the skin changes. Then you have the fibrotic skin, the lymphedema, which something I'm dealing with now in my breast. But and then the endocrine therapy, but all of those were temporary parts in my journey. I if anything, radiation right now, I have to deal with the skin changes, and that can be lifelong, as you know. But the endocrine therapy, this is something that I have to be on for 5 to 10 years. And to be forced into premature menopause at 30 years old was just something I never, ever thought I'd have to deal with. And on top of that, so I'll start by saying when someone tells you you're going to be going through chemotherapy and endocrine therapy, so it blocks all your hormones, you have to make decision on your fertility. So overnight, after I had surgery, the next day I showed up with drains hanging out of my chest and going to an onco fertility appointment because I had to make a decision. Do you want kids or not? Up until this point, I didn't think I had to, make that decision, or I wasn't really thinking about it because I had other, goals, things I was accomplishing in my life. But now I have to make this decision, which is a whole nother process. And I can have I have a lot of opinions on that, and things to say on that journey. But using hormone blockers, which is, tamoxifen or aromatase inhibitor, tamoxifen or estrogen receptor modulators, and then also GnRH agonist, which is the Lupron, and the Zoladex, which is it's an injection every 4 weeks, and I take a pill every day. The side effects are absolutely terrible, and I don't want to scare women, but I would even look at my mom when she was in her 50s, and she'd be like, "Oh, starts having a hot flash," and it seems so dramatic. I'm like, it's just a hot flash. It'll be over in a second. It is not. First of all, it is so debilitating, and on top of that, like you said, estrogen affects every part of your body, your brain, your bones, your skin.
Mhm.
I couldn't sleep. I would sleep like 3 hours. I would have hot flashes, and this is not exaggerating. And all my doctors would ask me at my appointments, and they would be shocked. About every 20 minutes, 24 hours a day, it would wake me up in the middle of the night, so I couldn't sleep. I couldn't concentrate. I'd lose my train of thought. I the brain fog that I felt. I felt like I couldn't think clearly, linearly. I would have word finding difficulties. The weight gain, that's a whole nother thing. But you can eat the healthiest diet, exercise all you want. That lack of estrogen really has an effect on you and your visceral fat, like around your stomach. It's just you can't you can't lose it. And it's not because a woman's lazy and she doesn't want to work out. It really is that hormone, imbalance or lack of. The bones, you get joint pain and you get horrible fatigue. But I always say I fatigue chronically, and I just think it's a normal part. I've just been, battling through. But it's been hard, and you still deal with it, and it's a prolonged thing, 5 to 10 years that you have to be on. And it affects you a lot at 30 years old, at 50 years old, 60 years old, whenever you go through menopause. I don't know if I'm scared. I'm scared to say I can't take these medicines because, in one sense, it is helping my cancer. It's preventing cancer recurrence. I do. If you have a lumpectomy, you keep the other breast, so it's preventing you from getting a cancer, whether it's in the other breast, in other parts of your body, an estrogen positive cancer. It doesn't just have to be in the breast. But I do wonder if it's even worth it, because the amount of side effects and the how negatively it can impact your life, your heart health, your cardiac disease, your bone health, everything, vaginal health. I mean, that's something we don't even talk about. Your sexual function,
Yep.
your quality of life. Oh my gosh, it's severely impacted. And I know there's a lot of amazing physicians, a lot of people are advocating now for the menopausal woman, but there needs to be more talk on women that are put into premature menopause through their treatments, whether it's, breast, uterine, ovarian cancer.
Mhm.
And it's a small area in medicine, but I think it's growing because we are seeing so many more younger
Yeah.
women.
Yep.
Um,
Yep.
I
Yep.
don't I don't know what I would choose. I do think about it, and every day I'm like, gosh, I just want to stop this. I don't know if I could keep going, but I just, uh I the beauty in it is you have the decision, you have the power, you have the decision making power to stop it whenever you want. So I can always reassess. But I
Mm.
think right now, until I have more information, I'll just keep going with it. And I've kind of figured out a way to combat most of the side effects. Things have gotten better. So I do want to mention that it has gotten a little bit better over
Okay.
time. So there's a little hope. But yeah, for now, I'm just gonna continue with the plan.
Okay. Got you. Got you. Um, how about what would be your advice in regarding breast cancer reconstruction?
Uh, so I think this is a tough question to answer because it's so individualized, it's personalized, and there's so many factors you need to consider. Um, First and foremost with yourself, and then with your, surgical oncology team. Um, but there's so many things that you have to consider. For instance, I'll talk about my own case. When I was diagnosed, it was in the prime of my career. I was just about to graduate. So you have, the lumpectomy and the mastectomy. With a lumpectomy, you have shorter recovery typically. But usually with a lumpectomy, it's the breast conservation, we say. And a lot of physicians favor that now. There's even studies that show with partial mastectomy and radiation, you can have the same, if not better outcomes as the radical bilateral mastectomies. Back in the day, we were just chopping everyone's chest off left and right.
Yeah.
And we're seeing that maybe we don't have to be so radical about our approach, that we're having similar outcomes. But with lumpectomy, you do radiation. With bilateral mastectomy, typically you can defer, you don't have to have radiation. In my case, my tumor was extremely centrally, medially located, that even if I was to do bilateral mastectomy, they said I would need radiation regardless. So I'm like, so why would I put myself through the more difficult surgery? I also need radiation. Why don't I go with the lumpectomy? Um, but then also you have to look at the side effects, if there's side effects to radiation. So if you don't need radiation, if I didn't need it, maybe I would have chose the mastectomy route. I don't know. I didn't realize how much goes into the recovery with radiation, and physical therapists like you are so important in our journey. That's another thing I learned from day one. You are still with me a year and a half later. There's some people that I'm seeing only 6 months, 3 months, but I am regularly coming to physical therapy because of these side effects, the lymphedema. So radiation is not, just go 4 weeks and you're done. But with mastectomies, If you choose to do reconstruction, then you're constantly going for expanders. You're filling them every 4 weeks. Eventually, a few months down the line, you're doing your expander exchange surgery to implants, and then who knows? What if your body rejects the implants? Now you're opening a new can of worms just because you're treating. It's part of the treatment process, but it's so difficult, and it's so hard to make that decision in that one moment. You don't know how your body is going to react. So
Yeah.
I think in that moment, it's just gathering all the information you possibly can. I think it's always important asking, what are my chances of recurrence if I choose this route? What are my chances of side effects? What's my chances of this side effect if I decide to do this, treatment? Getting all that information, and then hoping, you can't beat yourself up. That's another thing in the end. After I made my decision, a lot of my friends said, regarding which route you choose for your breast cancer reconstruction, you cannot regret it
Mhm.
moving
Absolutely.
moving on in the future. If you Now sometimes I do, and I feel like I'm not the only one, but should I have just done the mastectomy? What if it occurs in my other breast? I think it's um a woman's lifetime risk of breast cancer is 13%, and then once you're diagnosed, the percentage goes up 1% every year in the contralateral breast if you keep it. So
Okay.
now I'm like, what if in 10 years now my risk in the left breast is 23%? That's pretty high. If you keep your breast, you have to do the mammograms, you have to do MRIs every 3 to 6 months. So now you're being exposed to more radiation. So it is a very difficult, question to answer. And I just think you need to consider all these factors. And in a way, I feel very fortunate that I knew all these things going in because of my background. And I
Yeah.
honestly I feel bad for the patients that have no medical backgrounds.
Mhm.
And it takes a lot of time to explain these things. And I feel like a lot of doctors, I luckily had an amazing medical team. Dr. Spiegel is wonderful,
Mhm.
but it's important to ask all these questions and how your life will look like in the short term, in the long term,
Yep.
month from now, year from now, years from now, because it doesn't just end with the surgery.
Yeah, yeah. And that's a great point you just made. And you mentioned this before, like getting second opinions or third opinions is super important. You don't know how many patients will see that they just come to the first doctor and they just don't, it's not maybe perhaps the right or the best treatment possible or a standard of care that these patients should have, but they don't know any better. And they just feel like, well, if there's the doctor and the doctor is what they recommend, I'm gonna do what they recommend. But just really look into, okay, who is this doctor? How many surgeries or how many years of experience just doing breast surgery is happening? You don't want to have a general surgeon just doing breast surgery. So you just want to make
That
sure.
and do that. So yeah, it's important to know all that information. I felt a little crazy. You mentioned the second opinion. I actually got four opinions because I just couldn't believe that um this, like I said, this was happening. That was a very common thought in my head for a long time. But um I you are the one that is will have to live with all the decisions that you make in the end, right?
Yeah.
So I got that first opinion from University of Florida, my initial um, medical team. Then I got an opinion from a surgeon or an oncologist in up north in Staten Island University Hospital. Do you really think I need chemo? Does my uncle's type score really matter? But my lymph nodes were negative, but I'm young. And they said it's not an easy decision, but looking at all these factors, yes, I do recommend it. Then I got an opinion through Florida cancer specialist. Do I need chemo? And is this chemo the right option for me? It's not just do I need chemo or not? Is it ACT? Is it TC? 4 weeks, 6 weeks?
Mhm.
It's, so, and then I got another opinion from Memorial Sloan Kettering, and I was lucky enough that all of them said yes. Well, lucky. I was hoping they would say, no, you don't need chemo, but they did all agree that I didn't
The
need.
four of them.
Yeah, initially that, my original physician, what they recommended, what they agree with, and that just made it more comfortable for me moving forward with this
Yep.
decision.
Yep.
So I think the one thing that I learned at being a patient is get second, third, fourth opinions. As a physician, if I see that a patient has any hesitancy to what I am counseling them on or uh, recommending for them, I tell them, and I'm not offended. I said, please do your own research. Please get a second opinion. I encourage you. And then come back to me if you agree, if you want to move forward with this, because I want you have to feel comfortable with what you're deciding. These are big decisions you're making.
Yeah. But you know, you are an amazing physician, and that's why you're doing that. But you know how many physicians I even come across that I've been working with that they're like get offended if you are like, you know, if you're a primary care or you're you know, internal medicine or family practitioner, and then, you know, that's why it's a specialist, right? Not that you don't know your stuff, but you perhaps are not the orthopedic doctor that I think this patient needs to be referred to. Or you come with like, you know, a positive mammogram. What is your first thing? I'm gonna send you to the breast surgeon, right? Because they're the specialists, right? I'm not gonna planning to manage this, but still, how many times physicians wanted to try to really manage all on their own, right? And they're like, if you ask for a second opinion, they get like upset. They get it's like, no. So I always tell patients, if you go and ask your physician you want a second opinion and they give you a hard time, you better change physicians. This is not a good physician for you.
And even specialists, like not just private, I think everyone should know their limitations. That's the most important thing as a physician, is knowing when where you fall short. Be
Yeah,
honest with what you're not as educated in and tell them, I'm not sure.
yeah,
I think patients really appreciate that.
absolutely.
And then do your research, or even as a specialist, like everyone practices differently. Maybe you won't like what one oncologist, surgical oncologist recommends for you, and you get a bunch of different opinions and you prefer to go with your third option, and that's okay. But
Mhm.
as long as you have the more information, the better. Knowledge is power.
Yep, absolutely. That's a very good point there. What is the most painful lesson along the way?
mm, there's a few. I think for Sandra, uh, I had a lot of expectations about myself and the way my future would look like, and I I was forced to look at it differently after that, that diagnosis. It had to change. So a lot of expectations for myself, what my life would look like. Um, it's funny, I was actually speaking with one of my really good friends, Lola, who has been there for me from the beginning to the end and will continue to be. But I asked her, what is something that I talked about for a while I was going through this? And because I'm like, I can't remember much now. I kind of buried it, put it to the side for a little bit. She said, you talked a lot about pre-cancer Sandra and post-cancer Sandra. And I'm like, wow, you're right. I would always talk about that. I would mourn. I was mourning so much the life that I had before cancer, the pre-cancer and the post-cancer. You're never going to be the same person. Um, I think, especially with like the endocrine therapy, the pre-cancer, Sandra was,
Yep.
functioning at her highest capacity. She had all the energy. She didn't know what it was like to she didn't know what it felt like to not have your estrogen. She didn't even know what that even meant. And now afterwards, it's learning just how to navigate your new day to day. It's learning to set certain boundaries for yourself, other people.
Mhm.
Um, I I don't know. I think just being okay with that, being okay with not being okay, and learning how to navigate your new self,
Mhm.
um, and kind of not mourning it anymore, but uh, finding your new way and being okay with it. I think that was a very painful, like a big lesson that I learned. And also actually, uh, how much you had to have faith in your medical team, and how much you had to let go of control,
Mhm.
because I feel like I'm a very calculated person. I take control in a lot of situations, and this is just one thing that I could not control, and I just had to um, kind of go along with the punches. And
Mhm.
once you allow things to unravel, you have to be on top of everything, but kind of letting go of that control. And it just takes away so much of that anxiety. But I think that was a hard lesson to learn, is that I could not control the situation. You can't control when someone schedules you, when you get in for this appointment, when how this person treats you. And it's just a lot of things uh, that were hard to, like, it was a tough pill to swallow, but it was a good
Did you
learning
have you have any counseling try to help you with the situation?
counseling. It's funny. Actually, so my surgical oncologist, your first appointment for me, you go in and they tell you, you have cancer. This is what it may look like. I'm going to refer you to XYZ. One of them is oncology, physical therapy, occupational therapy, plus or minus, and then counseling. And I'm like, counseling, but I'm not depressed. I'm not suicidal. They're like, yeah, but this is a lot. This is a lot you're about to take on. Um, and then so I went to the appointment because I didn't have to, but it was part of like the onboarding, I guess you would say. But that was one thing I completely didn't put first. I feel like was my mental health. I was so focused on fighting this and beating this physically, but it was so overwhelming. The amount of appointments I had, about like 10 appointments a month. You're going for pre-op testing, MRIs, biopsies, ultrasounds, mammograms, physical therapy, post-op surgery, to the surgical oncologist, to the plastic surgeon, to the oncologist, to the radiation oncologist, that I said, I cannot throw another appointment into the mix. It's too much. So if that's one thing that I would definitely probably would have tried to. I have to mention, I worked full time during this. I did not take any breaks.
I
So
yeah.
I'm sure if I had that extra time, I would, but that's why it's so important to really have that strong support system, because they were my counselors, my friends, my family. They got me through. And really leaning on those people that have your best interest, and getting rid of the toxic people that, that aren't really cheering you on from the sideline, and surrounding yourself with love and positivity. That was my form of counseling. um I think I felt very alone because I was so young and premenopausal, and a lot of friends, they tried to help. They said, oh, my aunt, she's 70, she just went through breast cancer, it was tough, but you'll be okay. And I said, oh, if you want, you could talk to her, I'll give you her number. And bless them, for
Yeah.
wanting to help me. And I but the thing is, I feel like I couldn't, they wouldn't understand what I'm going through.
No, no.
Just as bad when you're 7, at any age, any cancer, any age is terrible. But a 7-year-old woman, to me, I said, she was done having children. She already went through menopause. She may not even need endocrine therapy, or it may be less severe because chemical menopause is worse than natural menopause. It's more, the symptoms are more severe. I said, I want to talk to someone that is my age, that's going through
Yep.
something similar, has the same stressors. And it was so rare to find. Um, but I did have someone plug me in with a uh, so with a cancer patient, I guess survivor now, but she was my age, also OBGYN resident, went through the same thing. And I was initially really nervous about reaching out to her. I didn't want to bother her. But one thing I want to stress is just reach out to those resources. Do not be afraid, because it really helped me feel less alone. And now, being on the other side, I welcome it when people reach out to me. People like to help, right?
Yeah.
So I had a few people reach out and say, "Oh, this person is close to me. They're going through it. Can they text you because they're similar in age?" I said, "Absolutely." So that was my form of counseling, I guess.
Okay, very good, very good. But knowing sometimes we tend to be very, oh, I'm young, I got it, I can manage myself. But knowing that sometimes when somebody else who is a professional start to dig deep into your head and your heart, sometimes things come out that you're like, oh, I didn't realize that. Oh, wow, this is a good thing for me to hear and maybe start to, how can I practice this part, right? So sometimes it is very surprising how, as you know, Tony, the occupational therapist here, again, he's not a counselor, but that's a big part of what he does with a lot of our patients and breasts, is like really getting into this. how are you doing managing this? How do you doing managing the situation where you're being told all of a sudden, do you want to have kids? Yes or no? You have to make a decision now because you have to go through fertility for that if you want for this to happen. Or if you have already kids, how are you gonna approach the kids with this news, right? Without scaring them. Or if you're done or you're taking care of your parents who are older, how are you gonna approach that? So sometimes it's really powerful, like the things that we just listen and going sometimes to these appointments just for the initial eval and just listening and maybe get some good resources is helpful. But we have heard really great things about like a lot of things that he can help with. So again, he's just our OT, but just counseling itself, I think is a great idea.
Yeah, there's a lot of I've noticed everyone wants to treat you and focuses on, the cancer you. And then once they're done, like once surgical oncology is done removing the tumor, which they did a fabulous job. Once the plastic surgeon does their reconstruction, they're done. Oncology, they're just checking in on you, refilling your meds. But what happens to us once we're done with the active treatment? And now you got to go out in the world and start living.
Yeah,
And find your new normal. I feel like a lot of people that go through this, they know
absolutely right.
what I'm talking about, the new normal.
Yeah.
Um, and there is not a lot of resources out there for that. I feel like I had to constantly ask and pull out, it was like pulling teeth just to see if someone can help me with this side effect. And I was referred to integrative medicine for my hot flashes and, sexual dysfunction and all these things. But this was a year and a half later, or even pelvic floor physical therapy. Although this didn't help me per se because it didn't, I wasn't affected physically, with my pelvic floor. But there are a lot of women that are older that probably would benefit from pelvic floor PT, and this isn't provided to them early on. It's almost with years go by, and then they finally sometimes they may feel like it's not even worth mentioning because it's silly, but it does affect them on a day to day. And maybe they're embarrassed to mention it. So I think having those resources together early on is important. But
Okay.
the other
Yeah.
caveat in this is, which I was talking about, Shannon, my physical therapist, is in the beginning as a patient, I thought back on it. Would I even want to hear about that? Would I even want to hear about like PT and OT? I'm like, no, I just get the cancer, do the chemo. I want to get it out of me, right? You're in survival mode in the beginning. But kind of from the periphery, having those resources, whenever you enter this next phase, here are your resources.
Good
We don't,
point.
we're just out on our own trying to figure out suffering. And yeah, we definitely need more preventative medicine doctors in like cancer aftercare.
Yeah,
That,
you're
that's
absolutely right. Yeah, you are absolutely right. Um, what did that mean to advocate for yourself and how can people do that? I know you were really good at it.
advocating for myself.
Yeah.
Goodness gracious. Uh, I think the biggest thing was, I first and foremost, this is cliche, but don't take no for an answer. If you don't feel satisfied with what you're being told, you cannot just stop there. No one is going to. What I've experienced is a lot of people. Like, I felt like I was a number a lot in this journey. I really did feel like I was a number, and if I wasn't following up, there's so many times where I feel like I wouldn't have been called back. I followed up on all the results on my appointments. That I was told I'll hear from someone about my follow-up appointment or my first appointment with oncology. No one called. You have to stay on top of that.
Mhm.
It is frustrating. It is frustrating. I have patients that, come in and they say, "Oh, but I didn't hear from anyone. No one called me about the biopsy results, so I just didn't follow up." You cannot do that. And this, I think every single person has to deal with this is just how the system is failing us.
Mhm.
Everyone's burnt out. We have too much going on. Things fall through the cracks, so you have to stay on top of it. I feel like if I didn't follow up on a lot of these, a lot of the things that happened throughout my journey, I would have been in a much different place from now. I was on top of people, hounding them until I got, plugged in, until I got that appointment, until I got scheduled. and no one else was going to do that for me besides me. So really making sure that you're taking responsibility for yourself.
That's excellent. That's very good. Just very well said. What good resources for patients they can use to educate themselves? What would you advise them?
Resources. So like I said, I didn't go by, um, I didn't do too much research like Googling. I feel like I had a little bit of a background, but when it came to um, making decisions about chemo and surgery and radiation, obviously there's guidelines. You have the NCCN guidelines, which I did use, the National Comprehensive Cancer Network, evidence-based guidelines for cancer treatment and supportive care. But I think, and I could list a bunch of resources: breastcancer.org, American Cancer Association, or American Cancer Society.org. We know about these things, but I think an important thing that I learned that not a lot of people do is asking your physician to provide you with the data that, with the clinical data, with the evidence that they are suggesting for your treatment.
Mm-hmm.
Asking them, well, where did this come from? How did you come to make this decision?
Yep.
Challenge them in a healthy way. But I did that. I said, why do you recommend TC over AC chemo? What are the studies? And I was able to interpret that, and I know most people can't, but then ask them what this means. You
Mhm.
want to know that this is coming from a reliable source, and they
Yep.
are happy to provide that for you. My oncologist provided me
Yep.
with the NCCN guidelines. It's not just, okay, do endocrine therapy. Should I do tamoxifen and Lupron? Or just tamoxifen alone? Should I do aromatase inhibitor with the Zoladex injection? Why is one better than the other? What are the side effects? What
Yep.
is one worse than the other in side effects? So you should know all that information, and these physicians should be able to provide that for you. And if they don't know, they will get back to you. One of my oncologists said, it's a lot, I'll go through the studies and I'll send it to you, but ask your medical team to provide you with the resources that they're using to make that, make up your treatment plan.
That's excellent. How can people find you?
Uh, so I don't have any like TikToks or special social medias, but I do have my own personal, Instagram and Facebook. It's just my name, Sandra Pyda. I've been pretty candid, which is another thing about this journey that was odd. It's very personal. It's an intimate thing, but I, for some reason, was sharing it um, as if I was just talking to friends and family, but it was actually for the world to see. So I do have like a few posts on there that I posted along the way. But that's all I have. I just have my normal
Great.
social.
Oh, awesome. And I'll put it on the note show so
Mhm.
they know how to, if they want to reach out to you for a specific
Welcome
question.
anyone DMing me, messaging me, anyone my
Awesome.
age, older, going through the same thing. Any questions? I'm so happy to even meet up in person, go on a phone call, anything to help
Thank
anyone.
you. Thank you for that. It is one question that you wish I should have asked you, and how will you answer it?
Um, okay, so I think that we kind of touched base on this. I didn't think we would talk about it so much, but the endocrine therapy, and then just how important quality of life is, and moving on from that active treatment part of your cancer to afterwards, and how especially the endocrine therapy, how much it affects your quality of life. It's not just, okay, here's this pill, yeah, you'll be fine taking it, but we're treating your cancer. I feel like more people, more physicians need to focus on the side effects of these treatments.
Absolutely. Absolutely.
It is not benign. It really affects you day to day. There are people that honestly they
Yeah.
stop their
A lot.
cancer treatments a
Yeah.
lot.
Yeah.
I wish I knew the percentage off the top of my head. It almost feels like, I don't want to make up a number, but it seems like more than should be allowed. But they stop it because they feel so terrible,
Yeah.
and they're never counseled on how they will feel. Not once was I told what premature menopause was. Not once was I told what I should be what should I be looking out for, if I do experience this, what I can do. A year later, I was being told to go to maybe integrative medicine, and maybe Tai Chi can help, and maybe acupuncture can help. We should be told that from the start.
Yep.
Magnesium for sleep at night. That
Yep.
helps me with hot flashes. Making sure you're taking your vitamin D, making sure your heart is healthy, omega-3s. No one talks about this.
Yes.
No one talk making sure you're exercising. Has anyone told me about like specific diet and exercise plans post cancer? No. Of course you're gonna, okay, eat healthy, exercise. What does that mean? People
Mhm.
need more, people
I
need more what's the word I'm looking for? They
guidance, guidance.
yeah, and there should be exercise plans, diet plans, maybe
Absolutely.
weight training, building your bones. They're going to becoming more brittle. No one's even talked about DEXA scans with early menopause, estrogen deficiency. I'm 30. I haven't had a DEXA scan, so this is something that I'm lucky enough that you know, or I don't know, maybe I'm so stubborn that I'm constantly looking into things and researching, but this is something I'm going to bring up with my oncologist at the next appointment is, should we get a baseline DEXA? Because then osteoporosis or osteoporotic fractures, they can be preventable. So there's a lot of things that can be preventable if you get ahead of them. I just feel like we're not educated on, counseled on. Quality of life is important. And then one thing that it's not really a question, but I feel like I want to make this comment for fellow cancer survivors. Um, is don't I hated when people say, um, oh, well, now you're done, right? Everything's good, right? Because you finished the chemo, you finished the radiation. Please be more mindful that this is a lifelong process. You
You're right.
know, you're constantly still getting poked and prodded. You're still having appointments. Yes, they are an inconvenience. You're dealing with possible, cancer, secondary cancers in the future from your chemo. You're dealing with poor wound healing. People are still dealing with chemo side effects, heart problems from certain chemotherapies. So it's really never over. Check in with your friends, with your family. Even if it's a few years from now, they will definitely appreciate just how you're doing. It didn't end at the day that your surgery was over, the day that you finished chemo. It's a lifelong thing. And being mindful of that for any cancer survivor, I think, is really important.
Oh my God, this has been so helpful. We can talk for another hour, but I know you're busy and you need to go, but that has been amazing. Great information. I'm sure that the audience is really gonna enjoy this episode. So I really appreciate you being this with me, and I'm blessed that you being like in my life and we part of yours, and you will continue seeing each other for 5 years, right? This is our surveillance and hopefully beyond that. But thank you so much for being here.
Thank you, dearly, for having me. It was a pleasure and an honor. I really appreciate your time.
Absolutely. You have a great evening.